So recently I had a question that someone wanted to know, is it okay to do keto and intermittent fasting if you have a heart condition, okay? And this is a big fat yes. In fact, you're going to get a heart condition if you don't do keto and intermittent fasting. If you do the typical high carbs, you're going to get a heart problem. Let's talk about why. Because in the chain of events that occurs before you get a buildup of cholesterol, there's always damage to the epithelial lining on the inside of the arteries, okay? And what damages that is high blood sugar and high insulin, okay? So those two things will damage the wall. The cholesterol comes in as a Band-Aid, same thing with the calcium and the protein fibrin. It comes in there to help heal it. So it's not the bad guy, it's just there to heal it. And of course, the person, because they're consuming too many carbohydrates, they're going to have high cholesterol because those turn into sugar, and then sugar is converted to high cholesterol, okay? But that's okay because you can take a drug for that and lower it. It's called a statin. But the problem with statins is it causes insulin resistance and more insulin, so it keeps feeding itself. But then what happens, the arteries get stiff and the calcium builds up, and then of course you don't have the elasticity, so there goes the blood pressure. So now we have high blood pressure. Okay, but that's okay, we have a diuretic we can put you on. Well, the problem with the diuretics is they deplete potassium. Also, they will increase insulin and cause insulin resistance as well. So it feeds itself as well. And if you don't have enough potassium, it's going to be really hard to fix this blood sugar problem because people with high blood sugars and insulin resistance always have a potassium deficiency in the first place. And by taking potassium, you can actually improve that condition and stabilize the blood sugars a lot better. And the blood sugar and insulin problem will also cause high blood pressure because it's going to harden the arteries, make the arteries very inelastic, so there's no expansion. But no problem because we can put you in a diuretic, okay, to reduce the blood volume, and the pressure should come down because it increases your risk for insulin resistance, so therefore causing more insulin and propelling the problem further, and also creates a deficiency of potassium, which you need to actually fix insulin resistance, okay? And if it's going to pull up potassium, guess what? You're going to retain salt. So there goes the pressure as well. Now, if you have arrhythmias, for example, that's usually a potassium or a magnesium or an electrolyte deficiency. And of course, if you have a heart problem, you usually have insulin resistance, which means you can't absorb potassium that well. Okay, that's one of the functions of insulin, is to help you absorb these minerals. And this complicates and worsens this problem right here. So you can see that being on a keto, a healthy keto diet with a lot of vegetables, it's very important, and intermittent fasting that can drop insulin and help heal it. The combination is very powerful to heal the situation, so you can eventually come off of these with the help of your doc, okay? All right, thanks for watching. Hey, before you go, definitely sign up for my free keto course. I put a link down below. It's on Messenger and Facebook, but it will give you all the basics. It's very quick. It's like 3 or 4 videos, and it's free. Check it out.